ARDS, or acute respiratory distress syndrome, is an acute respiratory failure after a systemic or pulmonary insult that damages the alveolar capillary membrane, which allows fluid to leak into the alveolar sacs. We can think of this as a non-cardiac pulmonary edema. So like pulmonary edema, there's a fluid buildup, but unlike pulmonary edema, it occurs after a direct insult to the lungs rather than problems with the heart itself. Okay, so in ARDS, we are going to be looking at the structure in the lungs called the alveoli. So it's that grape-like structure, so this is going to be our drawing of a blown-up alveoli. So in a normal alveoli, O2 comes in, and then across this membrane, O2 and CO2 are going to diffuse in between the blood. So we get blood from the pulmonary artery coming in, O2 or CO2 is being taken out, O2 is being put in, and then we get reoxygenated blood going through the pulmonary vein into the rest of the body. But in ARDS, the membrane here becomes injured, causing the protein-rich fluid to leak into the alveolar sac. And when this volume exceeds the ability of the lymphatics to remove it, the edema moves into the airspace, impacting gas exchange here. So there is damage to type 2 alveolar cells, which produce surfactant, and reduction in surfactant contributes to alveolar collapse, which we'll talk about a little bit later. So how this is kind of relating to our top 20, again, coming back to that pulmonary edema, one of the mechanisms of pulmonary edema that we talked about was tissue injury. So as we spoke about up here on what ARDS is, we have that increased capillary permeability, which leads to movement of protein-rich fluid into the tissue, increasing that tissue pressure, leading to edema. So there's a bunch of causes for ARDS, including trauma, infection, septic shock, drowning, burning, smoke inhalation, and taking in toxic fumes. So injury to the alveoli itself, which is going to lead us to an alveolar collapse. So again, O2 can try to come in, but that water and damage to that membrane won't allow the diffusion of O2 and CO2 through the bloodstream. So basically, oxygen is not being put into the bloodstream, even though O2 is there. All right. So this is going to lead our patients into a refractory hypoxemia. So again, no matter how much O2 we can supplement and give our patients, it's not going to cross that barrier and diffuse properly. So O2 is not diffusing. So to fix this problem, the alveoli itself would actually have to be restabilized, and that's not something that would happen on its own. The incidence is 200,000 cases per year in the United States, and it has a high mortality rate of 29 to 42%, and that's just going to depend on the comorbidities of the patient.